Vortioxetine, also known as Trintellix, is one of the newer antidepressants on the market. And unlike some of the older options available, Vortioxetine works through a unique mechanism of action which sets it apart from other older antidepressants. But is Vortioxetine really better than our tried and true old school drugs like the sertralines and the escitaloprams of the world? Or is it just another new patented medicine designed to line the pockets of big pharma? How's everyone doing? It's Isaac Wade, Doctor of Pharmacy, and in this video we'll be discussing all things Vortioxetine, including how it works, common side effects, how to take it, some of my own personal thoughts and opinions about this medication. As always, this video is for informational purposes only. Always consult with your healthcare provider for any of your personal health concerns. So without further ado, let's get right into it. First of all, let's talk about what conditions Vortioxetine is used for, or I should say what condition Vortioxetine is used for, because unlike some of the other antidepressants, which can be used for multiple other conditions, Vortioxetine is only approved for treating depression. Sometimes it is prescribed off-label for treating anxiety, but it's really only been given the green light for treating depression. Now that we've talked about what Vortioxetine is used for, let's talk about how Vortioxetine works. Now, Vortioxetine has a multimodal mechanism of action, which means it works through multiple modes. Just like SSRIs, Vortioxetine works by inhibiting the reuptake of the feel-good brain chemical serotonin by the presynaptic neuron, leading to more serotonin available floating around that synapse, able to bind to and activate that postsynaptic neuron. However, Vortioxetine also binds directly to serotonin receptors, activating some and blocking others. Through this mechanism, Vortioxetine is believed to increase overall serotonergic signaling, leading to its antidepressant effects. But how good exactly are those antidepressant effects? Now, Vortioxetine is comparable to other antidepressants when it comes to efficacy, which is generally a modest improvement over placebo, with better results seen with more depressed patients and an onset of about 2 to 4 weeks. One large study, and one of my favorite studies of all time, suggests that Vortioxetine is in the middle of the pack compared to other antidepressants in terms of efficacy. It's likely better than something like desvenlafaxine and reboxetine, but it's probably not going to be as good as a drug like amitriptyline. Now, when it comes to side effects, the study also found that Vortioxetine was in the middle of the pack. Vortioxetine, it was probably better and it probably causes less side effects compared to a drug like clomipramine, but it's probably not going to be as good as a drug like fluoxetine. Now let's talk about side effects specifically. The most common of which is nausea by far, and it's experienced by just under 1/3 of patients. Other common side effects include vomiting, dry mouth, diarrhea, itchiness, abnormal dreams, and dizziness. Most of these side effects will fortunately go away over time as your body adjusts to the medication and can be reduced by increasing the dose slowly. A typical starting dose is 10 milligrams. However, for those more sensitive patients or older patients, a 5 milligram starting dose is also reasonable. Now, when it comes to sexual dysfunction, and unfortunately antidepressants do tend to cause sexual dysfunction, Vortioxetine does appear to be a culprit, and it appears to affect about 1 in 10 patients above placebo. However, Vortioxetine is believed to cause less side effects compared to other antidepressants, and Vortioxetine is a reasonable alternative for patients that experience sexual side effects from other serotonergic drugs. However, Vortioxetine is not as good as an antidepressant like bupropion, which does not cause side effects. Now, when it comes to weight gain, fortunately, it does not look like Vortioxetine causes weight gain. And when it comes to QT prolongation, which is just a fancy way of saying heart rhythm issues, it does not appear that Vortioxetine causes this side effect either. However, just like other antidepressants, Vortioxetine can cause a discontinuation syndrome if stopped abruptly. This typically includes irritability, trouble sleeping, and anxiety. The discontinuation syndrome from Vortioxetine is believed to be more mild due to its long 66-hour half-life, which in theory gives your body more time to adjust to being off of the medication. Either way, it is recommended to taper off the drug slowly and take the 10 milligram dose for at least 1 week before discontinuing the drug. Just like other antidepressants, Vortioxetine can also cause some rare but more serious side effects. These include increased risk of suicidal ideation at the beginning of therapy and during dose increases, which tends to be more prevalent among young adults and teenagers. Vortioxetine can also increase the risk of bleeding, especially if you mix it with common anti-inflammatory drugs like ibuprofen, naproxen, and diclofenac. Vortioxetine can increase the risk of serotonin syndrome, which can be further increased if you take other drugs that increase serotonin, such as monoamine oxidase inhibitors, antidepressants, stimulants, and dextromethorphan. Vortioxetine can also increase the risk for psychomotor impairment if you mix it with drugs like alcohol and cannabis, and vortioxetine may cause or worsen the manic phase in those suffering from bipolar disorder, which is why it's always important to rule out bipolar disorder when you're being diagnosed for depression. Now that we've talked about side effects, let's talk a little bit about costs and coverage. Unfortunately, as a new drug, vortioxetine is patented and is typically very expensive without insurance. If cost is a barrier for you, I would recommend asking your provider for a cheaper alternative, such as escitalopram, citalopram, and bupropion. These drugs are typically just as effective as vortioxetine and tend to only differ in terms of side effects. But if you've got deep pockets and/or great insurance coverage, vortioxetine is certainly a great option when it comes to modern antidepressants. Anyways, in conclusion, that's all I have to talk about when it comes to vortioxetine. I hope you found value in this video, and I can't wait to see you in the next one.